How long have you been with specialty care, and what is your current role?
I've been with specialty care since May of 2015, and my current role is the Chief Executive Officer.
So what is a day in the life of your job like?
I think one of the best things about my job is every day is a little bit different. Some days I'm working with the clinicians in the field. Some days I'm talking to hospital leadership. Sometimes I'm supporting some of our own leaders who manage our departments. I think I'm very lucky. I get a chance to see all the best parts of this company.
So your career took an interesting path because you went from a pediatric heart surgeon to CEO of specialty care. So what was that transition like from surgeon to CEO?
I was a surgeon for almost 25 years before I've had the pleasure to come work at specialty care. And one of the things that I find most interesting in retrospectively is that how much in common there was from my education to not just lead an OR, but run a department to there is to running a company. The skill sets and the people that interact, while different titles and different backgrounds, are largely the same.
So Sam, you transitioned from a pediatric heart center that you were running in New York to the business world. Why did you choose to transition to specialty care?
I had decided to move on from my clinical practice probably about 2013, 2014, but I came upon specialty care as an opportunity in 2015. Right around the time I had done an operation on a young man with a big tumor in his belly that was referred to my hospital in New York from a program in Boston that had turned him down for the procedure. And I typically wouldn't operate on a child with this kind of a lesion, but he was presented at our surgical conference with all the different disciplines represented, most of the people that we employ here at specialty care. So while I was in the back of the room, I'll never forget getting my breakfast together, I heard the patient's presentation, and then because I wasn't yet ready to sit down and comment, members of my team were opining. The perfusionists in the room said, if Dr. Weinstein's going to take out the tumor, we'll be there with bypass because the tumor is actually high in the chest near the aorta. The neurologist in the room said, you know what, we'll bring the neuromonitoring specialist because it's also near the spine. We want to make sure if we take this thing out that the child can walk afterwards. My surgical assistants said that they would change their schedule so they could be there with me because the case was likely to go long. Our minimally invasive team said that they would be present. We could do endoscopy beforehand to see if there were metastases. The whole team was ready to go, and I realized I had no choice but to agree to take the patient to the operating room and give it a go. I probably would have struggled to decide to operate if it weren't for the skill sets of my team and their creativity and dedication. Now, we did operate on that boy, and he survived, and we got the tumor out, and he did well for many, many years. But the word of that operation got around New York. It's not that small a town, and we began getting referrals for patients with thoracic and abdominal tumors in places where I wasn't even sure patients had places. And my practice grew substantially in that one niche amongst others. And it really wasn't because of me as the surgeon, it was because of the team that I had. And I began to understand the impact of the people at specialty care, what they bring to the OR is dramatic from a medical and an economic perspective, and it's very poorly understood. And I got excited to be a part of that. And I am honored that I can try to make that clear to all the hospital partners that we work with.
What is an album you can listen to from start to finish?
I find music without lyrics to be something I can listen to all day long because it's not distracting. If I could listen to jazz fusion all day long, I certainly would.
Can you give me some examples of jazz fusion artists that you like?
I like Keiko Matsui. I like the Rippingtons. I like anything that Spyro Gyra does. I wish I could play that well. If I could, I probably never would have gone to med school.
So how would you describe your leadership style?
I think the people who work for me are probably best to describe my leadership style. What I would say is that I'm probably very surgical, obviously, in my approach. I try to use information. I try to have a plan. I'm very, very results oriented and make it a little emotional if things aren't going the way I think they should.
If you weren't working in this field, what do you think you'd be doing right now?
Well, I originally went to college to play baseball, but the second week in the fall of my freshman year, I got cut. Coach said to me, son, you've got a nice game, but we got a lot of guys. And so after I called my father, who himself had played some minor league baseball, he told me to go do my homework. So I guess I'm grateful to both my coach and my father, but if I could do anything, I would have pitched for the Mets.
What is the best prank you ever pulled on someone or that someone has pulled on you?
Best prank? Well, maybe not quite a prank, but I recently got goofed a few years ago. My kids, I have 4 kids, for my 50th birthday, gave me a list of the 50 things Dad says the most. And they were all hysterical, and it pointed out a lot of the things that I may have said that they've laughed at over the years. But what they really goofed me with was they had emailed each other to create lists, and they had to pick 50 out of a list of over 200. Apparently, I give a lot of advice.
What was the last TV show you binged?
The last show I watched, my wife and I watched Alaska Daily, which I think is based on a true story. We enjoyed a lot, and right now we're working our way through Peaky Blinders. You gotta be careful when you watch it, though. You can't watch it right before bed. It gives you nightmares.
What is your comfort food?
Well, I would say that my comfort food before moving here was Grater's Mocha Chip ice cream, made in Ohio. But now that I've been living in Nashville, it's definitely fried chicken.
What is the most effective way for you to unwind?
My favorite part of the day is actually the very first part of the day. I get up about 4:30 or 5, and I will get on the treadmill and I'll watch Sports Center, or I'll take a walk with the dog. For me, it's the most peace that I get. Most people aren't up at that hour. I get my best thinking done and most reflection.
What is a moment in your life that you would like to relive?
I'm not sure I would pick a single moment, because there are so many moments that make up a life. But in terms of experiences that I love to be a part of, now that my children are all adults, anytime that my wife and I can be with them, where they're together, even when they're with their spouses or boyfriends or girlfriends, and they are carrying on amongst themselves, and my wife and I are almost peripheral to the whole experience, those have been the best moments over the last few years, because I can see not just how wonderful they are together, and how wonderful it is that those relationships are going to last.
So do you have any party tricks that we don't know about?
I'm not that interesting at parties, but you may not know that I'm actually perfectly ambidextrous. I'm not right or left-handed. And it's the original reason I went into surgery. As a middle schooler, I had a battery of tests done to see where my strengths would lie. And the educator who did my reviews said, oh, he's ambidextrous, he should be a surgeon. And somehow that stuck.
What are you most proud of in your life?
Well, let me speak professionally about that, because obviously we have our families and our personal lives, which are usually more essential and central to who we are as people. But one of the things I'm most proud about is that in both of the careers I've had, I've been able to, or try to, teach people how to make the impact in their careers that they want. Whether I was teaching residents to be heart surgeons, or whether I'm empowering our own clinicians to have the impact in the operating room that they want, or trying to support our leaders to support their divisions. It's really a gift to give something, but I think it's a greater gift to teach somebody how to keep giving on their own.
So where is the most interesting place you've ever lived?
Well, definitely one of the most interesting places I've ever lived was on an Indian reservation in Chinle, Arizona, among the Navajo. My wife and I took a job there for about a year when I worked with the Indian Health Service right before my fellowship training. And that was absolutely fascinating. The beauty of the land and the beauty of the people. I learned more there than I've learned anywhere else since.
So I'd imagine with almost 25 years in surgery, you have some pretty interesting cases. Can you talk about any of your most interesting cases?
Sure. There's more than 10,000, so it'd be hard to pick out just one, but there is a procedure that I remember specifically, not because of the technical elements. It was a straightforward heart transplant and a 2-year-old, but because after the procedure, there was an untoward event. There was something done that resulted in the child arresting. And what I remember most about the procedure is that upon my re-entering the operating room, my team shared with me all of the information that had occurred from the time I left to the time I had returned in such an open and honest fashion that we figured out what was happening to that child within seconds and were able to correct the issue. What actually occurred after that was that the child remained on a normal recovery despite having had a cardiac arrest. So what I learned is, from that procedure, it's really not the first mistake that's the issue. It's the mistake after that. And the way you handle mistakes is what leads to your success.
So Sam, is there a guilty pleasure that you'd be willing to share with us?
Oh, sure, we all have them. As a surgeon and then a CEO, I'm probably a little bit too serious, but I do love going to comedy shows. Anytime I see a name I vaguely know or whose work I like, I will, wherever I am, traveling or at home, look to see who might be playing at these clubs and always try to get a ticket.
So Sam, you have taken two sort of tracks with your education and career through medicine and the business side. So is there some advice that you can pass on to people who are looking to pivot mid-career or just have a love for sort of lifelong learning?
I think one of the things that I've learned is not to take your mistakes too seriously and realize there is always something to learn. In medicine, we end up training year after year in different clerkships or specialties. I remember a very painful way I learned this lesson after being a fully trained general surgeon at Columbia in New York, moving on to the cardiac surgical training program. On my first day, all excited, I met the chairman there, was going to assist him with the first operation of my first day of fellowship. And after I introduced myself and asked him to tell me what I could do to help him with the procedure, he responded to me, quote, "You mean without leaving the room?" That surgeon ended up teaching me most of what I knew about adult heart surgery. But what I realized on my own after his comment was the perspective. No matter what I knew in general surgery, it meant nothing to this new profession. And so there's always the opportunity to take what you know from the past, merge it with what you're learning in the future, and get a better result going forward.